Good evening, everyone. Thanks for joining us for this Kojo and our community event. Anxiety, isolation, and hopelessness, the pandemic mental health crisis. I'm Geri Mitchell, the midday host at WAMU. Before we get started, a special thank you to our sponsor, Johns Hopkins Medicine. Tonight, I'll be fielding your questions and comments throughout the show. This is a conversation and we want to hear from you. We encourage you to ask questions, make a comment, or share your experience. Please use the Q&A window at the bottom of your screen. When you're ready, click on the Q&A button, type your question or comment there, and then hit send. Make sure to add your first name and your location if we can say it on the air. Our producers will comb through the comments to make sure we're not asking any duplicates. Then I'll read some of your questions to Kojo and to our esteemed guests. I apologize in advance for any mispronunciations. We do encourage you to get your questions in early. There tends to be a rush toward the very end. We'll also be offering live captions during this event. If you'd like to see them, select the closed caption option at the bottom of your window and then click Show Subtitle. Thanks so much for being here with us this evening. And now, with that housekeeping out of the way, it is my pleasure to say, here's Kojo Nnamdi.
Thank you, Geri. Hello and welcome to you all. Before we begin, I just want to take a moment to thank our sponsors for tonight's event, Johns Hopkins Medicine. So without further ado, let's get started. The COVID-19 pandemic has meant isolation, anxiety, and uncertainty for many of us, and it's taken a toll on our mental health. According to a CDC poll, the rates of depressive disorder in adults increased fourfold between 2019 and 2020. Anxiety increased threefold, and mental health conditions are disproportionately affecting certain demographics, like the Black community, young people, and essential workers. How can we better care for ourselves and others? And will we continue to experience elevated levels of anxiety and depression, even if we see the light at the end of this pandemic tunnel? Joining me now to discuss this is Dr. Erica Martin Richards, Chair and Medical Director of the Department of Psychiatry and Behavioral Health at Sibley Memorial Hospital. She's also an Assistant Professor of Psychiatry and Behavioral Science at Johns Hopkins. Dr. Richards, thank you for joining us.
It's a pleasure to be here. Thank you.
Also joining us is Ryan Williams, a mental health advocate with the National Alliance on Mental Illnesses Northern Virginia chapter. NAMI Northern Virginia offers support for individuals affected by mental health conditions through support, education, and advocacy. Ryan Williams, thank you for joining us.
Thank you for having me. I'm glad to be here.
And Sarah Jones is a school-based mental health therapist with Mary's Center, a community health center serving 60,000 residents in Northwest DC. Sarah Jones, thank you for joining us.
Thanks for having me.
Dr. Richards, I'll start with you. This pandemic has upended our lives in ways we never imagined. How has it affected the average person's mental health?
So that's a great question, and I've received it multiple times over the past year. What we're seeing is about a fourfold increase, specifically in anxiety and depression. So while there were, of course, people that experienced these symptoms before the pandemic, in a CDC pulse survey, so just essentially checking the pulse of households across America, we're seeing a fourfold increase in people that are experiencing anxiety symptoms and depression.
You mentioned anxiety and depression, things that some people may have experienced maybe for the first time during this pandemic. Can you explain what the symptoms for those might feel like?
Absolutely. So with depression, we're talking about, of course, people attribute a lot of the symptoms to sadness, but there's so many other things to consider. Changes in sleep, that can be increases in sleep or inability to sleep. Changes in appetite, again, in eating more. Some people refer to eating comfort foods or not having an appetite and experiencing weight loss. Isolating yourself, not keeping in touch with friends and family members that you'll usually talk to. And we see these symptoms persist daily for about 2 weeks And at that time, we want you to seek help, to ask more questions about, am I depressed or am I just feeling down because of the need to isolate and not being able to do my usual things?
Please underscore for us how we make the distinction between feeling down and something more serious.
The big question is whether or not it's affecting your life. Is it affecting your relationships? Are you getting into more arguments with the people that you're close to? Are you able to concentrate? Are you able to get work functions complete? Are you able to complete assignments if you're in school? So we really want to hone in on, is this affecting how you usually live?
Sarah Jones, tell us what you do as a school-based mental health therapist who works with high school students.
Of course. Well, I think it might be helpful to just say a little bit about what Mary Center does. So Mary Center is a federally qualified health center that provides healthcare, social services, education, and workforce development for folks regardless of their ability to pay. And sorry, my cat is currently popping up on the table. Sorry about that.
Cats seem to be absolutely fascinated with Zoom calls. They want to see everybody who's on the screen.
She didn't care at all until I started talking, so apologies. So as a part of my work, I'm on the school-based mental health team. So we work in partnership, Mary Center, with schools to embed therapists in the school setting so that we're providing therapy to kids in their school to increase access, and then also provide mental health education and resources within the school to families and teachers and staff.
So how have you seen the pandemic affect your students? What changes have you seen?
Well, a lot of what Dr. Richard said really resonated. So I would say really a huge piece. I see high school students personally, and major changes in sleep, weight gain and loss, really big changes in grades, isolation, a lot of not showing up to therapy sometimes. So really seeing those symptoms of anxiety and depression across the board.
Ryan Williams, you have been with the National Alliance on Mental Illness, or NAMI, for many years. What first brought you to this organization?
A lot of this started was when I was first trying to seek answers about my mother. My mother, while growing up, suffered the effects of a serious mental illness. She was diagnosed with schizophrenia, and no one ever explained to me as a child what she was going through, how she was going through it, how it affected her. It was just myself and my brothers, we would see how it would affect her, whether she was talking to somebody that we couldn't see, or whether she was seeing someone that we couldn't see, or trying to climb the walls. There was just a lot of stuff that was going on that we just didn't understand. And so many years after I moved to the Washington, DC area, I decided to seek out the National Alliance on Mental Illness so I could learn about what was going on with her, because nobody ever explained it to me. So here I am, I'm in my late 20s, and I'm attending a family-to-family class, which NAMI does to teach caregivers about dealing with your loved ones who have a mental illness. While I was in the classroom, I started realizing that a lot of the things that I was learning about affected me as well. So I'm what they call a consumer. I'm someone that's affected by mental illness also, as well as advocating on behalf of mental illness. So my journey to come with NAMI was basically because I was trying to learn about NAMI, and I was inadvertently just kind of, exposed to, hey, this is something that's going on with me. And after I had a serious event, I decided to check myself into a hospital. After my treatment program and everything, I decided to get more involved because I wanted to give back to the community. I understood how it was growing up and how, mental illness was not talked about within the community, how we could normalize what people say of being crazy, so to speak, because everybody has that family member that's, need treatment, but we need to normalize basically trying to get help and trying to get assistance. And I figured if I can at least come out there, I can at least help and be that voice.
Well, as you just mentioned, you personally are living with mental health conditions. What symptoms do you experience, and what treatments have you found to be the most helpful?
As for symptoms, actually quite a few of what Dr. Richard said. my work was affected. There was time I would just call out from work. I wouldn't go into work. I just wanted to be home. I wanted to be alone. Sometimes I would just stay in a dark place. Other times I would just be on the computer all day, every day. My days were basically in between going to work and just coming home and either sleeping or just getting on the computer. So I would try to spend as much time just avoiding everybody and everyone and anything that required me to go outside and do anything else. And so my treatment actually was, at first it was a cocktail of medications. I had anti-anxiety, I had antidepressive, I had antipsychotic, I had mood stabilizers. I had quite a few medications that I was dealing with. Once I was able to get everything up under control, I worked with my my care team, which was my psychiatrist and my physician. And we kind of worked on a plan that was a bit more of a long-term plan. So they took me off of the majority of the medications. And once I was stable, or what they call, my depression was in remission, I was able to just pretty much do therapy. And I'm only on one medication as of now. So it's like, as far as treatment, a mental illness is not something that's cured, but you're going to deal with continuously for the rest of your life. Is basically how you decide to go about doing it, how you're going to actually treat it, how you're going to actually move forward with trying to basically stay on top of the water and not drown, just trying to keep yourself up there at baseline.
Ryan, how has the pandemic affected your mental health?
Oh, the pandemic has been rough for me. But then again, I imagine that it's been rough for a lot of people. So, I mean, just look at it. We're in a situation where most people have to stay in a house. They can't go anywhere. People are getting cabin fever. I was reading a statistic recently. Was talking about the number of people that's actually having more and more depressive symptoms just because of being in the house. You don't have that social connection where you're around friends and family. You can't really go around friends. You can't really go around family. You might infect them. They might infect you. Everything is, it's a coin toss on what can happen. And so with myself, I know that there are days that I just have to get out of the house. But my way of getting out of the house was going to the park, walking outside, social distancing, taking my kids out with me as well, because I know it's been hard on them. I know I have two teenagers. One of them was recently diagnosed with ADHD and major depressive disorder. The other one, we think he may be ADHD, but we know that he's been struggling with his schoolwork, whereas the older one has been doing fine. As far as myself, this has been, my work with NAMI has allowed me to just kind of get in front of people and to at least talk to them, to let them know that, hey, you're not the only one that's dealing with this. You're not the only one that's going through some of the stuff that that you probably have to go through with anxiety, with depression, with not sleeping, with staying up all the time, or sleeping too much, so to speak. So for myself, I've been hit. There are days that I'm up, then there are days that I just don't want to do anything.
Geri Mitchell, we have a question or comment?
Yes, Kojo, Shay says, my son is 32 and lives in New York City with his girlfriend. He had a psychotic break in August 2020 and was hospitalized for a week and diagnosed with bipolar 1. He finally has a therapist, and I hope he'll build a plan for managing his disorder. How should I encourage him to work with her, and how can I help from my location in Baltimore?
Dr. Richards, I'll put that question both to you and to Sarah Jones, but first you, Dr. Richards.
So the good news is that this illness has been identified and there are medications to treat it. And to what can we do? I think Ryan has highlighted the importance of NAMI, the importance of understanding these illnesses that are affecting us, that are affecting our community. And the best thing that you can do to support someone, because I imagine, if we do this live, post-pandemic or even pre-pandemic, I would sit in an audience and I would say, raise your hand if you know someone that's been affected by mental illness. And, essentially all hands go up, because we all have a loved one, a family member, a friend, an acquaintance, a neighbor that's struggling with this. And the best thing that we can all do is ask questions so that we understand what someone needs for support. Sometimes it is to have a quiet walk alone. Other times it is to talk and have a conversation about the things that are creating stress. But I'm thankful to hear that there are medications and therapy involved in the treatment, because what we see is that, some people will say, well, I don't want medications and I don't want to see a provider because I know they're going to recommend medications. Others will say, well, therapy doesn't work for me. And it's important to understand that both do work, but the timing is really important. If you try to do therapy only, but medications are needed, you won't be in a state where you can receive that therapy. So it's important to have a plan and to involve loved ones and treatment providers together so that you can feel that support.
Sarah Jones, care to comment?
Absolutely. Just piggybacking off of Dr. Richards, I work with psychiatrists at Mary Center, and when psychiatrist said to me that therapy and medication together, they work so well in tandem. It's as if somebody who has a mental health condition, you're in the bottom of a hole, and that a ladder is medication and therapy teaches you how to climb the ladder. And so really both of those pieces together, they're just such powerful pieces that work together. When someone is ready, absolutely, Dr. Richards, the timing is so important. I would also say, and something that I say with parents a lot, because working with teens, I'm also working within the family structure, is I use the metaphor of being on an airplane, and that, when you get the warning that you need to put on your own face mask before you put on the oxygen mask of your child. I think that's really true in this case too. So thinking about for you, mom, what are the things you can do to take care of yourself? That's a really hard question right now in this pandemic. But what are the ways that you can put on your own face mask? Is it going for a walk? Is it doing advocacy work for people with bipolar disorder to change the system so that your son feels more supported? I think, having some empathy for yourself and taking care of yourself in the ways you need to is vital.
Dr. Richards, I know I've talked about anxiety and depression, but are there other mental health conditions that have been exacerbated by this pandemic?
So the big ones are the anxiety and depression, but there are a few others. And one of the things that we're seeing in addition is that people are waiting to seek help. And so we want people to come in a lot sooner, because the first question was from someone that experienced psychotic symptoms. We know that anxiety, we know that untreated bipolar disorder can lead to psychotic symptoms. And when we talk about psychotic symptoms, we're talking about a break from reality. The way that you're interpreting the world around you is different. So I want to quickly touch on the need for the treatment, because that then can evolve into other diagnoses that we're seeing. But the one thing we haven't mentioned yet is substance use and substance use disorders. So alcohol and drugs, essentially what we've seen is about a 13% increase in people that are either saying they've started using something or their use has increased during the pandemic. So we want people to be aware that this does fall under behavioral health, and it is a mental health issue if that is a mechanism that you're using to cope.
And Geri, we have another question.
Yes, Kojo. Sue from Rockville asked, what tools are available for those of us who may not be clinically depressed, but struggle with motivation to restart regular activities, with making the effort to see people, to come out of our homes, and to deal with the way the world has changed?
Ryan Williams, I'll start with you on this one.
That's an interesting one, because everybody is a little bit different. I know for myself, what I started with was actually volunteering, not necessarily through NAMI. I've continued that. I've never dropped that, not for an instant. But I was doing some work with the Medical Reserve Corps, just helping with the vaccine efforts. It's allowed me to get out, talk to people, understand and learn more about people. I typically work with the mobility and disability areas, so I was more than likely wheeling people around, but it did get me around people. It got me in a space where I can start feeling comfortable around people again, that I can actually talk, because I think a lot of us probably have forgotten how to communicate with people face to face, because we spend so much time on online platforms, whether it's Zoom or Microsoft Teams or Amazon Chime. We're somewhere facing a camera, trying to interact and talk with people, and it's not the same. So some of the things that you possibly do is just small talk. It's one of the things that will actually get you used to people, that you can actually start having a conversation, because like I said, this year has been hard for us. it's been hard for everybody, whether you have a mental illness or not.
And Dr. Richards, speaking about not being able to talk to people, can you talk about the effect that this pandemic is having on persons with dementia?
So what an interesting topic. And at Sibley Memorial Hospital, we have an aging population that we see frequently. And one of the things that we saw is a lot of families did what they thought was the right thing to do, which said, okay, to our elderly, family members populations, you stay there, I'm going to stay over here, and everyone will be safe and no one will catch COVID, and we'll see you, after this ends. Well, the pandemic lasted a lot longer than we thought it would, number one. And one of the things we know that helps with dementia is interaction, is regularly seeing people that that you can identify, going out to the lunch every Thursday or whatever the case may be. And when we cut off aging populations, and we know that dementia is a diagnosis that occurs later in life, then we took away a lot of the tools that they had really to stay grounded. And so what we saw, again, was similar presentations in an emergency setting, worsening dementia. People with aging were also experiencing depression because they really relied on seeing the younger people in their family. So it's been tough. It's been tough for age groups across the board.
Indeed, Sarah Jones, have you been seeing those signs of depression among young people who are not able to interact, frankly, with their grandparents or with their peers?
Oh my gosh, absolutely. I mean, I think that's the number one complaint I hear. I had a session with a junior in high school today who we talked about emotional safety versus physical safety. And her mom is very, very strict about COVID guidelines. And we've gotten to a point where she feels so depressed and isolated from her friends that the emotional safety, I think, has outpaced the physical safety risks. And one thing also that I think is important, just to Sue's question earlier, is thinking about that we are in a collectively traumatic experience right now. And so I think it can be helpful to use that as a lens that we're all recovering from trauma, and that it's important to pace that out with your own comfort level.
Geri, we have another question.
Yes, we have someone that says, I am dealing with the loss of 2 family members this past year. Where can I find a list of therapists or providers to access help? It is very challenging to find someone quickly and who is also affordable.
Have any suggestions, Sarah Jones, Ryan Williams? First you, Sarah Jones.
Oh, that's so tough. I'll tell you that just in terms of my knowledge of mental health providers across the city, everyone is absolutely inundated. So I think that exploring some platforms like BetterHelp has been an avenue that a lot of people have done with online therapists. I think that is one of the positive things about the pandemic, is that accessibility has increased now that virtual sessions are billable for therapists. So that's exciting. I would also say, and this is a tip that I use with a lot of my families, is to contact your insurance provider, and they can send you a list of therapists in your area who specialize in certain subject areas. And then you can contact them to see if they have availability. But this is a flaw with our mental health care system, that it is so challenging to find and connect with a therapist, and we need to change it.
Ryan Williams.
First of all, I would like to say I'm definitely sorry for your loss. I know going through the pandemic makes dealing with loss and grief much, much harder. I would like to echo what Sarah Jones has said. Try to reach out to your insurance provider. If you are working, see if your company has an EAP program that may provide some type of, counseling sessions, some help or whatever. Because I know at least with a lot of the larger companies in the area, they have an employee assistance program that will allow you to have X amount of therapy sessions with someone. Also, BetterHelp, as was mentioned, and I believe somebody recently mentioned something about being able to find a psychologist on a listing on Psychology Today. I'm sure there are plenty of resources. Sometimes Google is your best bet for that, but definitely try to reach out to somebody sooner than later. And I'm sure that, there'll be somebody out there for you that will be within your price range. Oh, by the way, one thing. When I first started therapy, I actually did it through Georgetown University when they were having their students in residency. And it was a way for me to get help because I didn't have a lot of funds at the time. And so they work on a sliding scale. And you may be able to get something through that if they're not inundated.
Dr. Richards, this person has experienced loss and is seeking affordable providers. What would you advise?
So I think that Sarah and Ryan both have very good options. Finding someone is the first question. Finding someone that feels like a good fit is the second question. And those can seem like two different things. So the first thing, I think Sarah and Ryan hit the idea as well, which is going through either the search engines that are available online, going through your providers. Now, it is very hard sometimes to find people with availability because we know that the pandemic has hit everyone hard, and we are trying, certainly at Johns Hopkins Medicine, we have multiple sites, including Sibley, Suburban, Howard County, Bayview, and the East Baltimore Hopkins campus, where we are either seeing people that need hospitalization for acute psychiatric care, that need outpatient care as well. So there are options at Johns Hopkins Medicine, but those might not work for everyone, and there still might not be that availability. So really working with either your insurance provider or people that do sliding scale or fee for services, that is available. That's number one. Number two, finding someone that is a good fit. And I encourage anyone that starts therapy to really give it a chance. You're going to go in, and after the first visit, you're going to say, well, that just feels weird. I'm talking to someone about all of my, private business and personal things, and I don't know them and they don't know me. But you have to give it a few visits at least to find that rhythm. We talked about kind of culturally sensitive care as well. Like some people say, well, I only want to see a woman, or I only want to see someone from the same race. And sometimes that's possible, but I can tell you in the African-American community, there's 2 to 4% of people that are African-American psychiatric providers or psychologists. And so you may have to find other ways to connect with providers.
Let's talk about that for a second, because as we said at the beginning, some demographic groups have been hit harder by the pandemic in terms of their mental health. What have you seen, Dr. Richards, across age, race, or gender?
Ooh, so that's a good question. So we'll start with gender, and we know that even pre-pandemic, women are twice as likely to experience a major depressive episode compared to men. And we've seen that magnified through the pandemic. We've seen, not all cases, but in many cases, we've seen women that have discussed having to choose between career and now, virtual learning at home. And so that's created additional stress at home as well. We know that there are other resources available, but we are still seeing about a twofold difference in women reporting depressive symptoms than men. So that's number one. Age. We're seeing, Sarah mentioned young people, high school students, but we're also seeing kind of young adults that, 18 to 20s range that got sent home from college and are now trying to live as young adults in a house that they thought they had, moved on from. And so a lot of people are experiencing these stressors. And if we talk for a minute about the African-American community, then what we're seeing, and a lot of people have been saying, well, there's coronavirus, but then there's the other pandemic, right? Because the timing of this was so in line with the movements to fight for, justice and policing, with the George Floyd murder. And so, at the beginning of this, we had people that said, well, I want to go out and I want my voice to be heard, but I'm afraid I'm going to catch coronavirus. So what am I supposed to do in these settings? And that created additional anxiety and stress in this community. In addition to that, of course, the communities are being hit harder by the pandemic. They're experiencing loss. And so there's the grieving on top of everything else. So there's multifaceted hits that are happening.
Glad you mentioned the whole issue of police violence or police relations, because Geri, I think we have a question about that.
Yes, Kojo. One of the attendees wants the panel's thoughts on how the reckoning around police violence and social injustice is affecting people's mental health. They say on one hand, it may be good to talk about it, but it's also upsetting to see these incidents over and over. Any thoughts on managing that stress?
Ryan Williams, is this something you've discussed?
Yes, it has, especially with my daughter. My daughter is 16 years old. And I remember one time last year, after continuously seeing the stories in the news, she broke down and she started crying because she's like, she's an African-American woman and she's wondering, it's like, why is this happening to us? Why are people killing us? Why is it that we're being targeted? Why is it that you have to have a talk with us about what not to do and what to do if you get stopped by the police or if somebody says something to you? And it's very traumatizing for her because she's looking at this world as a young woman that's growing up and not really understanding the racial injustice. And so my talk with her is pretty much, let's talk about it. Let's not hide anything. Let's come out and let's talk about it. Let's talk about the history. Let's talk about, what you can do as a young person moving forward. Let's talk about the initiatives that you can get involved in. She wanted to go out and do the protest. She went out and protested. She masked up. She did everything that she needed to do. She made her signs. It made her feel better. But at the end of the day, the issue is still there. And I know one of the things that's helping her move forward with this is being able to talk to it and talking to a therapist, because otherwise she needs an outlet. Just like every other young person, adult needs an outlet to be able to get this stuff off their chest. But I also feel that this is a conversation that needs to happen a lot more often with a lot bigger audience.
Sarah Jones, I assume this is something you've been dealing with also.
Absolutely. It comes up in sessions all the time with students. I work primarily with Latinx students. Mary Center has historically served immigrant families, largely from Central America. And so it's been on the mind of many of my students. And I'll just say, in terms of navigating it, I think it's important to name it when everything was happening during the summer, really just bringing it into sessions, naming it, and then letting students go wherever they needed to go. Because for some students, it is too much to think about. And also, I'm a white lady, so it might not be a place where a student feels that it's a safe place to explore that with me. And I completely respect and understand that. But I think it's important to name it because we need to call it out, like Ryan was saying.
Well, Dr. Richards, I don't really need to ask you this question because I know the answer, but I will. Is there still a stigma in the African-American community around mental health and seeking treatment for it? I say I know this because over the years, I have recommended to several associates, if you will, that they seek mental health, and their response is, what are you saying, I'm crazy? Dr. Richards.
So the broad, really, really good question. The broad answer is yes, there is still a stigma associated with it, but less than we think. So what recent studies have showed when they investigate women in this case, but when they investigate why people are not seeking treatment, stigma is much lower on the list. It's finding a good provider. It's being able to get off work to go to the appointments. I mean, there are other barriers that are there. There are some people still where stigma is associated with it, but it's being addressed, right? I mean, we have a former First Lady, Michelle Obama, who was able to say, to people, listen, this pandemic's been hard for me. I've experienced some low levels of depression during that time. And so we're seeing more and more people that are talking about it, and it is becoming more of a conversation, which is a good thing, but we still have the other issues that we talked about, which is how to get people to treatment, but they're talking about it a lot more.
Glad to hear that. Sarah Jones, you, as we mentioned, work with teens who are Latino and who are also immigrants. In your experience, is there a stigma around mental health issues in Latino or immigrant communities?
Absolutely. This is something that my colleagues and I see across the board. And I would say that it makes sense given historic mistreatment and racism against immigrants and Latinx folks. So I also think that in my experience working with Latinx immigrant families, it also isn't a cultural norm to express emotions in the same way or process them as we do in therapy. But I also think it's important to put that in the context of the larger culture where I think that's similar because we're very open about, for example, oh, I have to go to a doctor's appointment. But when we have a therapy appointment, we say, we hide that. So I think it's important to contextualize that this is something, that stigma still exists outside of the Latinx community as well.
And Geri, we have a referral for assistance.
Yes, Mary with the Women's Center encourages Northern Virginia and Washington, D.C. residents to reach out to them at thewomenscenter.org. They have sliding scale services and accept the insured and uninsured.
Remember, you can ask a question or make a comment if you go into the chat function, into the Q&A section there. You want to do that before the end of the broadcast because these things disappear before you know it. Ryan Williams, one of the silver linings of this pandemic is that we've been talking about our mental health more, even in the workplace. What do you think that businesses and managers should be aware of when it comes to the mental well-being of their employees, and how can they better support people's mental health?
I think one of the things that they can do well is to at least learn about what it is to deal with a mental health issue. Everybody is going to present differently. You may have the person that may not want to talk to people. You may have the person that just they talk to everybody, but they're actually hiding the depression that they're feeling. They might be dealing with dysthymia where they're high functioning, they come to work, they do their job, and then they go home and they just feel horrible. And they're dealing with anxiety. They think that they might get fired or so on and so forth. We have a lot of cases where, yes, corporations are trying to normalize talking about mental health and mental illness fairly recently. And I've had the chance to go through and talk to different companies and talk to their people, whether it's been Amazon, Google, Freddie Mac, all of these companies are doing their best. But on a larger level, they're doing it, but on a smaller level, managers still need to have the empathy in dealing with them, because you can put a manager in that position and you can give them the training to deal with it, but they have to actually believe that they're going to be there to help. They have to actually believe that they're going to be a leader to somebody that's dealing with this problem that may not necessarily open up to them, because not everybody opens up. And even where I used to work at, they started normalizing having conversations, and I gave a talk in front of the audience of my peers. And it took some of my peers to come up to me afterwards to tell me about the issues that they were having. Some of my own coworkers that I never knew, but that's because nobody really talks about it. You can talk about going to get cancer treatment. You can talk about, going to the doctor, to get a bone repaired, but you mentioned anything about having, depression or anxiety or schizophrenia, bipolar, borderline personality disorder, any number of illnesses, you cannot talk about it because of the way that people will view you. And that has not yet to be normalized in the workplace. But once we get to that point, I'm hoping that people will be a lot more understanding, have a lot more empathy, and we can move forward as a people a lot better.
But when your fellow employees come to you and express that they're having these kinds of mental health problems, but are reluctant to share them with their employer, do you have suggestions for them about how they might be able to navigate that?
Yes. So one of my first references is always to NAMI, mainly because NAMI is a grassroots organization. It has been around for a long time. Every program that NAMI does is for free. They charge for nothing. They have support groups that people can go to. They have family-to-family classes where if they have a family member, they can learn about mental illness, learn about the journey, learn about the treatment options, even learn about self-care for themselves. They have peer programs which allow people that's dealing with the debilitating mental illness to learn about what it is they're dealing with, to learn the symptoms, to learn when they are starting to spiral and how to get help, how to understand the medication. They have other groups that include, the schools, whether it's Ending the Silence and having people that are their age explaining how they deal with their mental illness journey. There are all these resources that are currently out there. We just have to take advantage of them. Otherwise, if they are dealing with a mental illness themselves, I first tell them that they don't have to disclose it. That's the first thing first. I myself, I tend to put myself out there. I'm in front of everybody. I'm an advocate. This is what I do. This is what I'm comfortable with. Everybody is not comfortable with putting themselves out in front of people and talking they deal with, whether it's suicidal ideations or whether it's crying in the shower. Nobody wants to talk about that stuff. And that's acceptable. That's understandable. But the first thing that I try to tell people is, if you're dealing with a problem, seek help. And here are some resources that you can get help. And if I don't have the resources, I'm sure that NAMI or some other organization will have the resources. And at least if I'm working at the same company, I at least know about the EAP program. I have served in a wellness ambassador position before. So I've at least been able to kind of help guide people through that journey, at least within my own companies.
Geri, we have another question.
Yes, Kojo, Kim says, I've battled depression since 5th grade. With the pandemic, I have called suicide prevention. All I get is, why not volunteer someplace? No romantic partner. Family is in different states. Please advise.
Dr. Richards.
So Kim, that's another good question. And I think there's a few things. And we didn't hear about other interventions that have been tried, that sort of thing. I think one of the highlights that's important to note is that there was a study that came out, I think in 2005, that indicated that for depression, people take on average 6 to 8 years to actually seek treatment. And so they are, in hindsight, are saying, no, this has been there for years. Anxiety is worse. Anxiety is closer to 10 to 15 years from when it starts. So in Kim's case, there are a couple of things. It's hard and it's frustrating, not only when you call and you feel like you get the same response every time, but then if you add other interventions, if you talk about medications, and some people will say, I've tried every medication, but there's new things on the horizon. There's new FDA approved medications that are as recent as 2019 for what we call treatment-resistant depression, which really just means either you can't tolerate the medication trials or you've tried a few that have not worked for you. There are more interventions, there's more hope, there's a lot of research that's happening. So calling those hotlines certainly are meant to intervene if you're feeling desperate, but the longer term question is, can we get you to see someone that can really help to navigate those next steps, understanding everything that you've tried? But Kim, it's important your question is not in isolation. I think there are other people that wanted to ask similar questions, and there is help. Whenever someone says, well, nothing's worked for me until this point, I have seen people say that and I've seen people get better. So there's a stepwise approach. There's research that's been done on step 1. If that doesn't work, let's move to step 2. Unfortunately, it does take time. And that is what a lot of people find frustrating.
And speaking of those hotlines, if you or someone you love need immediate help, you can call the National Suicide Prevention Lifeline at 800-273-8255. There's also an online chat available for the deaf and hard of hearing if you go to suicidepreventionlifeline.org. For texting, the Crisis Text Line is a texting service for emotional crisis support. To speak with a trained listener, text hello to 74174. Sarah Jones, what do you see as the biggest barriers that some people, including your students, face when accessing mental health care during this pandemic? And are they generally open to mental health care like therapy?
Oh, wow. That's a big question. So the first is, what were the barriers to access, correct?
Yes.
Okay. So one of my colleagues, she said to me, and it really hit me. She said, I lost my job in this pandemic. So all therapists, and really all of us, we had to completely relearn how to do our jobs and to do it overnight. And so, oh goodness, and I lost my train of thought for a moment, sorry. In terms of the barriers to access, that is something we absolutely saw for our students, because we were having to perform therapy completely over Zoom through phone calls, and working with primarily students of color and folks of lower socioeconomic status. absolutely impacted, as we saw, the pandemic disproportionately impacted those populations. And so as a result, an example of something I heard as a barrier would be students didn't have internet access in their home. They didn't have computers. They didn't have phones. And so as a result, they were completely cut off from services. And so it was really hard to keep delivering therapy and support when there was no access in the first place. And for those with the highest need, which was incredibly scary and frustrating for clinicians and school staff. And I'm sorry, Kojo, can you say the second part of the question?
Are your students generally open to mental health care like therapy?
I would have to say, I think it's a pretty mixed bag. So I have a lot of students who they've come from previous therapists and they've been in therapy for a long time. And, they come in and say, okay, I know how to use the sand tray. I know how to do a mood check-in. And then students who there's a lot of psychoeducation on what is therapy, what is the process. So I would say it's kind of half and half on my end with high school students.
How about you, Dr. Richards? What are the most common barriers that you see to people getting help, and what can be done to address them?
So there's ongoing work and efforts. Number one is access to providers. We know that there are not enough mental health providers available. And if we start there and say what can be done, it's recruitment. It's getting young people energized about this field in high school, in college, even in medical school, when we have to choose a specialty. It's showing people the need. This is a new and developing field. I'm talking about research that's happening. I mean, unfortunately, it's moving slower than other areas. If we talk about cancer, we can say, okay, we're going to biopsy this tumor and we're going to know how to target it with medication, with radiation, whatever the case may be. And we can give you an idea about your treatment plans. With psychiatry, a lot of times we can't do that yet. And that's what makes it harder for people to access care. We can't say, look at this image, look at this, reading, and this is how we can tell you what your diagnosis is. So there's some people that are skeptical because we don't have that. A lot of times we don't have that tangible evidence. And then getting people to understand, this is how we come up with this diagnosis. And this is why this treatment is what we want to start with. But when people start antidepressants, we have to say, this might take a month or two before we know whether or not it's working. And if it's not working, we may have to either change the dose, we may need to add something or change the medication. And so a lot of times that's when we lose people that are interested in getting care because it feels like such a long process. But I have seen this process work so many times that I encourage people to really stick with it because there are options available.
Geri, we have a question for Sarah.
Yes, Christine wants to know, what have you learned about resilience from the young people that you work with?
Wow, that's a really beautiful question. Well, I would say that I have felt that my therapy sessions with students were sometimes a lifeline for me. It was really wonderful to be able to continue to connect with students in spite of all of the barriers. And also, we're in Washington. Washington has been bananas the last year and a half. And so I think seeing students learn how to do virtual classes, continue in therapy, finding ways to connect with one another has been, for me, really inspiring. I would say that the word resilience is hard for me because I also think that sometimes we're asking students to do things that they shouldn't. We're asking people to be resilient, to push through circumstances that are really challenging, to continue as normal, and things are not normal. So the word resilient is a little tough for me these days because it's something we really emphasize here in the US. And sometimes I think we need to change the systems so that people don't have to be as resilient, if that makes sense.
In a way, the same question for you, Ryan. The pandemic has been a dark time for many of us, especially those of us living with mental health conditions. But as I just was asking Sarah, in a way, have there been any silver linings that have come out of this in terms of how we're talking about our mental health or access and availability? Ryan?
I believe there has been a lot of good that has come out of this. I know from NAMI standpoint, NAMI Northern Virginia, at first we were kind of struggling just to resume our normal course. We weren't always at the schools or at the hospitals like we used to be. But as time went on, we found that Zoom was actually a viable way to kind of reach people. Some people would prefer to actually be on a Zoom call as opposed to being in person. Or some people, they want to be able to ask questions anonymously. So we have found a way that, we can still reach people even in the absence of being there in person. And I know with companies, they realize that dealing with mental health issues has become a priority because they have people that come to work and they're not going to be doing their best job if they're dealing with any type of depression or anxiety or any other type of crisis. Maybe they're dealing with grief. They're not going to have the same type of motivation moving forward. So if they don't have the same type of motivation, then the ROI is going to drop. And companies are starting to realize that. So even though it's going to hit their bottom line, the other part of it is they're taking an interest in helping the workers that are there and helping them to kind of keep working at a level that keeps them focused. So I think that at least with the silver lining, a lot more people are having this conversation. And it's not a conversation of, oh, this person might be having this issue, but the rest of us aren't. But the real reality of it, everybody is having some type of an issue. We're looking at almost 1 out of 3 these days on people dealing with some type of mental health challenge just during the pandemic. That's still kind of up there. Whether it's, you're dealing with depression or whether you're just kind of sad or whatever, people are dealing with things, but now it's more acceptable to talk about it now because everybody is going through the same thing.
Dr. Richards, even those not suffering from depression or severe anxiety may be struggling right now as the pandemic wears on. A New York Times article from last month went viral for talking about quote unquote languishing, which is described as the blah feeling, the absence of well-being. Are you hearing about or seeing this in your practice or among friends and family?
They are. And I think there are a couple of things that people need to remember. Number one is please go easy on yourself. That's the number one thing we want to get across, which is, we've seen headings that say it's okay to not be okay, or, what are you doing with people, or why aren't you out and about more often? And the language that you talk about, Kojo, is related to that. It's, there's introverts and extroverts, and people say the introverts were so happy when the world shut down because they got to stay home and they didn't have to do much. And there's extroverts that were panicked. And now we're seeing, there's this mix up. How do I identify myself? What do I want even moving forward? And there's a couple of things. This is not a push to talk about vaccinations, but as people are getting vaccinated, they are feeling more comfortable to re-enter society, to go to functions, to be around other people. And when we talk about languishing, that is one of the treatments, that is one of the interventions that we recommend, which is to get out and to do things. And the way to do that is, again, we know we have the mask recommendations from the CDC at this point. We have vaccinations available. The language that we're feeling is because we now need to reset. And the curve, if we were able to see the curve for recovery of our social interactions, there's going to be a long tail, because there are still some people that don't want to go out, that are nervous about eating in restaurants, and that's understandable. But like anything else, and we won't go into the different therapies that can help with this, but there are things that say, what are you afraid of? And how can we address that, right? Cognitive behavioral therapy, there's interventions that we can do to say, if it's going out with others, can we start with a group of 3? Okay, now can we do a group of 5? Can you space yourself out from those people and ease yourself back into what would be a normal routine for you?
Sarah Jones, is languishing something you've seen in the students you work with? When I was in high school, my father often accused me of languishing, but not in quite the same way. I was looking for rewards to improve my grades. But is this something you see, Sarah Jones?
Well, I've sent that article to, I think, about 3 of my students. So it absolutely is something that I'm seeing. Just so many students saying, I just want this to be over. I want things to go back to normal. And this sense of just being stuck in an uncomfortable place. It's absolutely something that I'm seeing. And that article has been really helpful. And I think this kind of goes back to something that Dr. Richards said, actually about a question about bipolar disorder. Sometimes just being able to name something is so powerful. So having that article and sending it, and students being able to say, oh, there's a name for this feeling, there's a name for what I am going through, has been really helpful.
Sherry, we have both a suggestion for a self-help group and a question about overdiagnosing. Go ahead.
Yes, we do. Ellen from Frederick mentions that there are self-help groups like On Our Own. It's a peer recovery and support community. And then there's a question here. Juliet asked, I wanted to ask about the conversation around overdiagnosing mental illness. Do you think there is any merit to these concerns?
Dr. Richards.
So when we talk about overdiagnosing mental illness, I think Sarah again hit it on the head, which is we have to call it something. And sometimes we have diagnostic criteria, right? We're looking at how long has this lasted? Are you meeting the symptoms? I don't see as much of an overdiagnosis. We won't call it major depressive disorder unless it's meeting those criteria. Sometimes we call it grief if you've lost a loved one. Grief if you've lost a job. You know, there is job insecurity, there's food insecurity, and those things we take into account. And so we'll tell you, listen, you're just adjusting to these changes. We're not going to call it depression yet. We want to try these interventions first. We want to try these therapies first. So I'm, along with my colleagues and the way we've been trained, is to really use caution with the diagnosis. But I think you should feel empowered to ask someone to explain why and how they came up with that diagnosis so that you feel comfortable that we've gotten it right.
And Dr. Richards, some people might think the anxiety or depression they're experiencing is temporary because of the pandemic. But do you think the pandemic could have a lasting impact on our mental health? I've heard many people mention post-traumatic stress disorder as something we could experience in the years to come.
It's certainly possible. And we talk about different groups that would experience it for different reasons. You know, as a healthcare provider, we've talked about the healthcare providers that have been on the front lines. And a lot of them are actually experiencing either post-traumatic stress disorder, levels of mood disorders, because again, there's this risk that they've taken for the past year. And so there's a lot of things that they've seen, a lot of people injured, hurt, dying. Now that's not only with healthcare workers. We talk about people that are covering the news and have had to hit it from that perspective. So we do know that there will be lingering effects on this. The same way we talked about re-entering society is the same way we're going to have to recover from this. If you don't find that it's working, that's when we want you to reach out for help. But we also want you to allow yourself the time to recover slowly.
Ryan, your organization, the National Alliance on Mental Illness, or NAMI, offers free programs for those who want to seek help or just learn about the options. I know you've been involved with them as both a participant and as an educator. Tell us about the peer groups that NAMI offers.
So there are a couple of different peer groups. The first one is one of the classes that I ended up taking myself. And I did it through the Montgomery County NAMI affiliate. And you can find them at NAMIMC.org. But also there's also NAMIDC.org and NAMI-PGC and NAMI-NorthernVirginia.org. All of those are within the DC area. With regards to the peer courses, with the peer-to-peer, you learn about your illness, how to deal with it, how to look for the warning signs with the medication, therapy options, and you pretty much do it in a safe setting where you can be around other people. But you also have the peer groups that allow you to just kind of sit and talk to other people. It's more like, you know, It's just a basic support group where you can discuss in a safe setting, non-judgmental setting, what's bothering you, what's going on with you, what are some of your successes, what are some of your failures, and you can talk to other people that can understand what you're going through, because sometimes it's not always the best to talk to your loved ones. Your loved ones may not always understand, and you want to be around other people who really understand you. I know a few other things that's in the area. I know every NAMI affiliate has different programs, so they vary from place to place. So even though there are support groups that we may offer at NAMI Northern Virginia, there are others that may not be offered at, let's say, DC or Prince George's County and so on and so forth. But definitely they have the resources where people dealing with a mental health condition can go there and find education and find support and find other people that pretty much are just like them.
Just a couple of more questions. One for you, Dr. Richards. NAMI is one option for those looking for help. Where else can people turn for advice on their mental health?
So your providers are really good options for support. And at local hospitals now, there are a lot of different support groups that are coming out. There are online support groups that are coming out even related to COVID. So if you lost a loved one, if you were an essential worker. So like earlier, Ryan mentioned, your employee assistance program. If you are employed and that is an option, then we want you to utilize that. The same with young people that are in schools, in college, for example, there's student counseling services. So we want you to use the resource, at least start with the resources that are around you. In both cases, they may say, okay, we're going to start with 6 sessions, and then we'll be able to give you more informed direction about what the next step should be or where you can go. But I encourage people to use the people that are closest to them. And for others, it'll be their religious guidance. It'll be talking to someone that has the same faith or that offers faith-based ministry. For others, it'll be exercise and finding a group with that. Now, the group we haven't touched on yet are, of course, young people, new moms that had babies during the pandemic and didn't get that support as well. And so there's groups that have started with that so that they can virtually meet and discuss being new parents and the stressors that go along with that. So the nice part is virtually, there are options available too.
There's a lot more that we can talk about, but we're running out of time. And we heard Ryan talk about his own issues with mental health. But Dr. Richards, how have you been doing during this pandemic?
Well, thank you for asking. I am with everyone else. This is new territory and we are learning to navigate it together. I have little people at home that we're doing virtual learning. And so I'm grateful for my family and the support that they've provided for me to even be here and to help others. But it's been, we've needed the village, and, it's been important for me to be able to do forums like this to really let people know that they are not alone and that we truly, truly are in this together, and we will make it to the other side.
And Sarah Jones, how have you been doing?
Thank you so much for asking. It's been tough. I'm one of those extroverts that Dr. Richards talked about. And so it's been a very strange experience to be with people all day. I'm doing air quotes, with people all day and then emerge. And I've actually not spoken to one person face to face. And I've been using this metaphor, bear with me, but I've been saying that virtual connection is kind of like Diet Coke. It has all the sweetness of Coke, but it actually has none of the nutrients of Coca-Cola. And so I feel that I'm not really getting that connection or that level of nutrition that I need every day. So it's been tough, but you heard my cat. I got a pandemic cat, and I'm very grateful to have healthy family members close by. And my team at Mary Center on the school-based mental health team has been my saving grace, keeping me sane during this time.
Make sure you say hello to your cat for us. That's about all the time we have. Sarah Jones, Ryan Williams, Dr. Erica Martin Richards, thank you all for joining us. If you'd like to learn more about the National Alliance on Mental Illness and find your local chapter, you can visit NAMI.org. Mary Center offers community health programs, social services, and education throughout the DC region. You can learn more at marycenter.org. If you missed part of this conversation or would like to listen again, we'll be airing an edited version on WAMU this Friday, May 21st at 1 p.m. We'd like to know how you think we did. We hope that you'll take a minute to fill out the survey that will appear on your screen. It will help WAMU improve our virtual events in the future. We'd like to say thank you to our wonderful engineering team, particularly Rashad Young, Natalie Urv-Lifker, and Kenny Pirog, and thanks as well to Yanlin Zhang, Julia Slattery, Melissa Glass, Stephanie Schweike, Sydney Grannon, and Ingelisa Shortstorff. Thank you to Geri Mitchell for helping guide our conversation this evening. Can't wait to see you in person, Geri. And we're especially grateful to WMU's Mana Kashfi, who oversees our content. We'd also like to say a special thanks once more to our sponsor for this event, Johns Hopkins Medicine. And thank you all for joining us, and stay safe. I'm Kojo Nnamdi.